During apartheid in South Africa, there were soldiers who were told they were sick. Gay and lesbian soldiers told that who they loved was a disease that needed curing. Between the 1970s and the 1990s, the South African Defence Force ran something called the Aversion Project. An estimated 900 people, possibly more, were subjected to what they called the treatment: chemical castration, electric shock therapy, hormone injections, and in some cases, forced gender reassignment surgery. Not because these soldiers wanted it, but because the military decided their bodies needed to be fixed. Imagine being told that the most fundamental part of your identity is broken, and then being subjected to procedures designed to change who you are. Soldiers were given electric shocks while shown images meant to make them associate their own sexuality with pain. Some were drugged and assaulted by medical staff, all labeled therapy. Those who underwent forced surgeries were often discharged afterwards and abandoned. No support, no follow up care, just sent back into a world that had violated them in the name of medicine. The architect of this program was Dr. Aubrey Levin, who justified everything as medical treatment. After apartheid, he fled to Canada and continued practicing psychiatry until 2010, when he was finally arrested for sexually assaulting male patients. He served only 5 years. The South African government has never fully acknowledged what happened. Most perpetrators faced no consequences. The survivors, those who lived, carry these wounds still. What makes this historically significant is this wasn't considered fringe or radical at the time. Conversion therapy was mainstream. Homosexuality was classified as a mental disorder by the American Psychiatric Association until 1973. The Aversion Project used accepted psychological principles, behavioral conditioning, aversion therapy. The science was real. The application was torture. This is what happens when we let institutions define certain identities as pathological. Here's this philosophical tragedy. These were healers who became torturers while still believing they were helping. Medical paternalism taken to the darkest extremes. This reveals how easily authority and expertise can be weaponized when we fail to question who gets to define what is normal and who gets to decide what needs fixing. The deeper question is about power and pathology. How many other human variations have been medicalized, not because they cause suffering, but because they challenge social norms, gender identity, neurodivergence, cultural differences? The Aversion Project is a scar on medical history, a reminder that white coats and degrees don't guarantee ethics. The survivors deserved better. They deserved to be seen as whole, as human, as enough, exactly as they were. Science divorced from compassion becomes cruelty, just with footnotes.